Hey you guys, I have a topic today that's really intimate, but it's an important one because although I don't have the most amazing cut and dried answer for you, I want to share this with you because I really want you to know that if you have this issue yourself, you are not alone. So today's question is from a reader, and I'm going to go ahead and read it for you. It says, Hi Bri, I have a specific question to ask you. TMI for sure, but who else to ask but a women's health physical therapist, right? I went through Mutu 2 years ago, and this is a system for diastasis recti healing that I really recommend. So you can check the links below for a link to it if you'd like. So anyway, I went through Mutu 2 years ago. My tummy doesn't look much different, but I can jump now without urinary incontinence, so I know that it helped. However, I've been noticing some slight incontinence after standing up from using the bathroom, and even some now during intercourse. Can you direct me to the specific exercises that I could do that would help me? This is such a good question. This condition is actually called coital incontinence, if you want to really be specific with terminology here, but just peeing during sex. This is something that happens for between 10 to 27% of women who have suffered from bladder leakage in the past. So this is not an uncommon condition, considering that up to 1/3 of all women have experienced or do currently experience bladder leakage. Bladder leakage is really common, and so if you experience it also during sex, don't feel that you're alone. Unfortunately, many women end up avoiding sex altogether due to embarrassment or fear of this condition happening again. So this is really a quality of life issue and something that I am glad that we're addressing today. So the first thing to look at is whether the condition occurs during penetration or during orgasm. It's also important to consider what position you're in when this is occurring. If the leakage occurs during penetration, it's likely due to the fact that there is an increase in pressure on the bladder and the pelvic floor muscles are potentially either weak, overly tight, or just uncoordinated. If the urination occurs during orgasm, it could be that you're not actually urinating, that in fact it's a urinary ejaculate fluid that some women possibly may have. This is sort of something that I've read different things about, and it's difficult to say. It could be urine though. And if this is occurring, if there is urination occurring, then it is possible that your bladder muscles are actually overactive. Or again, you may have pelvic floor muscle issues. Either pelvic floor muscles are very, very weak or very, very tight or uncoordinated. So what to do about this condition? Well, the first thing you should do, and I highly recommend you to do, is to talk to your doctor about this. Your doctor or your healthcare provider who you work most closely with is the person that you are really, should be opening up to and telling them what is going on. If nothing else, so that they can have it in the records and track your condition and your progress over time. So talk to your doctor. The second thing that you can consider doing is to do kegels, but only if you can feel the full contraction and then also the full release. Kegels are a wonderful tool for really isolating and tuning into the pelvic floor muscles. This is important to develop body awareness and just kind of connection, brain-body connection, so that you can more easily coordinate them and use them and keep things in if you feel a leak coming on during sex. So kegels can be a wonderful tool to use in addition to your total core strengthening program that's going to work your glutes and all of your hip muscles, your abs, your back, your breathing diaphragm. But remember, they're only safe to use if you know that you're able to fully contract, but then also fully release after the contraction. It seems more and more these days I'm coming across people who are actually overly tight and overly tense in the pelvic floor. And if that's the case, if you can't fully release, or if you just can't really feel what's going on at all, or if you feel like doing kegels is actually making things worse, then you need to stop and not do kegels, because you likely potentially have an overly active pelvic floor, and that's potentially contributing to this incontinence issue too, because it's not that these tight muscles are necessarily strong or working optimally or coordinated. They're just tense, and so of course they're not able to keep the urine in and to keep you under control if they're not able to sufficiently and effectively work when you need them. So again, kegels can be great, but only if you know that you're doing them right. Now, if you want to try kegels, if you know you're doing them right, you know you don't have any tension issues, then I encourage you to play with maybe biasing the front of your pelvic floor muscles and the urethral and vaginal sphincters, so the circular muscles that surround the urethra and the vagina, as well as the broad fan of pelvic floor muscles. And I have a whole video about what the pelvic floor looks like and how to do this, so I'll be sure to link to that. But if you want to think about making your kegel contraction more toward the front of your pelvic floor rather than the back of the pelvic floor, that might be helpful for you with this condition. So I'd recommend doing maybe 5 to 10 kegel contractions with the squeeze and lift and the full release of those more anterior part of the pelvic floor muscles, and just see if that helps you gain a little bit more control. Test it out, try it for a couple of weeks, and see if it makes a difference. The next thing to consider is weight. In general, when you're carrying extra weight, you're going to be at a higher risk for incontinence or bladder leakage just overall. And so working on moving toward your ideal weight is a great way to just overall big picture reduce the risk of incontinence during sex or during other times. I also encourage you to limit fluid, especially alcohol intake, before sex. So if you know that tonight you're gonna get lucky, then I encourage you to not drink that extra glass of wine. You don't have as much control when you are under the influence, of course. So be careful with your fluid intake and use the bathroom before you have sex. Definitely prepare for the worst and be able to laugh it off if it happens. Be open with your partner, communicative with your partner. Bring a bath towel into the bed with you, put it under you, and just have an open mind and an open heart with your partner, and hopefully your partner will have compassion for you and you'll be able to just laugh it off if it happens. There's nothing that's going to kill the mood faster than you being ashamed of what's going on. I think if you just look at it as natural and something you're dealing with right now, something that could definitely change in the future, then that's great. Along the same lines, play with positioning. Look and see if maybe you can notice a trend about when the accidents happen. Perhaps you need to try putting your hips up on a couple of pillows or a wedge of some sort so that your hips are elevated if you're on the bottom. And that may help, especially if you have pelvic organ prolapse. That might help with the positioning of everything. It might help your pelvic floor muscles work in a more coordinated fashion. So just play with that. You may find relief from a little bit of external help, such as a cream that I have actually interviewed Dr. Anna Kabeka about. It's called Julva, and I have a link for it in the notes below the video. But it's a cream that is actually a topical hormone cream with an androgen in it that helps to improve the tissue health and actually can improve pelvic floor strength too. So this is really neat. There's some research that's being done on it. It seems very promising to me, and you might want to look into it. Again, it's called Julva, and it can help really with vaginal dryness as well as strength and just tissue health in the entire vulvar region as well as the muscles beneath those external tissues. If you do think that bladder muscle hyperactivity is contributing to your condition, then I encourage you to, again, be sure to talk to your doctor about that. So pelvic floor muscle training can be effective. And there are also pharmacological agents that can help with overactive bladder. They're called antimuscarinic medications, and they may be helpful for you, although you may also look into alternative remedies as well. There are some home remedies, kind of folk remedies, and potential evidence to support that certain essential oils may be helpful for relaxing the bladder and relaxing the body in general. And so you might consider trying relaxing essential oils such as lavender, ylang-ylang, even cypress over the bladder region, perhaps diluted with a drop or two of carrier oil. It's worth a try. The main thing to remember over all of this is if you're going to focus in on the pelvic floor muscle training, which again can be very, very helpful, the Kegel exercises, you might actually need to release the muscles before you can effectively contract them and strengthen them. So if you found that you actually do have more pelvic tension than you should have, then I encourage you to look into my or anybody else's videos or techniques that are helpful for relaxing and releasing the pelvic floor muscles, such as stretches, breathing exercises, visualization exercises, meditations, etc., that can be helpful to let go so that you can then be in good shape to know how to effectively contract those pelvic floor muscles. Now, to kind of circle around back to where we started, the woman who wrote to me, I checked in with her over the course of about 2 to 3 weeks, and although she didn't necessarily see huge changes in her incontinence issues during sex, she did say that she was able to really effectively utilize the pelvic floor muscles in a way that she had never been able to utilize them before. She was able to feel them and sense them in a new way, and she was hopeful that it would help with her symptoms down the road. She was really loving the improvement in body awareness and the improvement in ability to really effectively utilize the core muscles during exercise and just during daily life. So overall, a positive change. So thank you so much for watching, and if you have any suggestions or tips that have worked for you, if you have coital incontinence, please let us know in the comments below. I'm sure all of us would be interested. And again, I hope that you understand that the take-home message from all of this really is that you're not alone if you are dealing with this condition. So thank you so much for watching. And as always, remember, eat clean, move every day, and you will shine brighter.